This is the news in brief from the United Nations. The death toll in Israel from the attacks by Palestinian armed groups and in Gaza due to Israeli bombardments has continued to rise, with mass displacement soaring across the enclave, the UN Humanitarian Affairs Coordination Office OCHA said on Wednesday. More than 260,000 people, or over a tenth of the population of the Gaza Strip, have been displaced since the start of the current conflict, and the numbers are rising fast. More than 175,000 people have sought shelter in schools run by the UN Agency for Palestine Refugees, UNRWA. Working together with the UN World Food Programme, WFP, UNRWA has been delivering food to the displaced. WFP said that 164,000 displaced people also received vouchers to buy food from local shops, which remained open, and that as more people were arriving in shelters, the aim on Wednesday was to reach 200,000 with canned food and bread. Meanwhile, media reports quoting Gaza's power authority said that the territory's sole power plant was due to run out of fuel within hours, leaving the sealed-off enclave without electricity. The world is failing girls instead of promoting their rights, education and economic empowerment, UN Chief Antonio Guterres warned on Wednesday in a statement marking the International Day of the Girl Child. Mr. Guterres said that if current trends continue, the end of child marriage is 300 years away. 110 million young women and girls will miss out on their education by 2030, and 340 million will continue living in extreme poverty. He deplored the fact that girls in Afghanistan are being denied their most basic rights, and underscored the exclusion of many girls from the digital world, leading to new forms of bias and inequality. The UN chief expressed support to the girls who are fighting back against this dynamic and called for investment in girls' leadership. When women and girls lead, they can shift attitudes, create change, and advance policies and solutions that address their needs, he said. Severe bleeding after childbirth, known as postpartum hemorrhage, is the leading cause of new mothers' deaths around the world, yet it is preventable and treatable, the UN World Health Organization WHO said on Wednesday. WHO has just released a roadmap to help countries tackle the condition, which affects millions of women and leads to 70,000 deaths each year. WHO Director General Tedros Adhanom Ghebreyesus said that the new guidance charts a path forward to a world in which more women have a safe birth and a healthy future with their families. The UN Health Agency said that addressing postpartum hemorrhage requires preventing risk factors through quality antenatal care, including access to ultrasound, and effective monitoring in the hours after birth. Too often, however, health facilities lack the necessary healthcare workers, equipment, and supplies to treat the condition. The new plan seeks to establish a procurement mechanism to improve the supply of high-quality medicines to countries that need them most. It also aims to build awareness of the condition and improve health facilities, training, and research. WHO and partners will provide specialized technical support to countries to adapt the global guidelines into national policies, starting where there is the highest burden of maternal deaths. More than 4 in 5 deaths from postpartum hemorrhage happen in sub-Saharan Africa and South Asia. Staying with health news, WHO welcomed on Wednesday new funding to ensure that 370 million children receive polio vaccinations and to boost health innovation in low-income countries. Together with the UN Children's Fund UNICEF, WHO will be an implementing partner for the $1.1 billion financing package agreed by the European Commission, the European Investment Bank, and the Bill and Melinda Gates Foundation. WHO Chief Tedros Adhanom Ghebreyesus stressed that reaching on or under-vaccinated children in the most remote areas is essential for finishing the job of polio eradication, and UNICEF's Executive Director Catherine Russell insisted that no child should suffer from an easily preventable disease. The UN agencies will deploy the resources to eradicate polio, support the distribution of other childhood immunizations, and strengthen health systems so that they are better able to respond to emerging health threats. Dominika, Tomaszewska-Mortimer, UN News.